I'm impressed.
I turned it on.
Oh, yeah.
Good afternoon, everybody.
Good afternoon.
Okay, this meeting is called to order. We'll take self-attendance again, please.
Okay, Barbara Griffin, present.
Kelly's. It doesn't work. Kelly Bigley here.
Richard Manning, Acting Chief Deputy Sheriff's Office.
Corey O'Connor.
Sarah Namarato.
Susan Ivashevic.
Bethany Hallam.
Manny.
And point of order, Judge Ivashevic, I just want for the record to note that Mr. Manning is an illegal designee in violation of the state statute, and only Sheriff Krause has the ability to serve on this board.
But not under our bylaws.
Our bylaws cannot contradict state law. Thank you.
Okay. I would note that Mr. Perkins had a conflict and he's unable to be here tonight. So let's move on to community corrections, passages to recovery.
Good evening, Board. Greg Price, Director of Operations.
Hold on one second. Does anyone know what this bag is?
It's a bomb.
I think that's what Barbara's worried about.
I don't know what it is.
Well, Barbara just doesn't know what it is, and I think it has her a little concerned.
It's a suitcase.
It is kind of weird that no one knows what it is. Does anyone know whose bag that is? Does anyone know whose bag that is?
You gotta have a joke every once in a while.
Be careful,
Okay, go ahead. We're ready.
Greg Price, Director of Operations for Passage to Recovery. For the month of May, current numbers, we have 22 DOC clients. In the month, we had 1 revocation, 1 escape, no EMS trips via EMS for hospital runs, no self-injuries, harms, or suicide ideations for the entire month. Any other questions?
Questions? Ms. Hallam?
Hi.
Hello.
First question is the revocation. Can you give like a broad nature of what the violation was that sent somebody back to jail?
I believe he was under the influence and he was refusing direct orders from the staff to submit to a search.
Okay. And then the escape, was that someone who left the facility for something else and just didn't come back, like an approved leave and didn't come back?
Yeah, they were on an approved leave and never returned back.
Okay. Thank you.
Of course. Is it?
I have one. Is there any type of appeal process for a revocation?
Through the jail there is, yes. When they go back to the jail, they have to go back to the jail first, but after that, then they can take it up with the county jail officials.
Okay, gotcha.
Oh, good question. Can I ask a follow-up to that?
Of course.
So when they do the appeal process, does passages have any jurisdiction over the decision, or is it purely the jail decides if they're allowed to come
Purely
back?
the jail.
Okay, thank you.
Thank you.
Thank you.
Yes, ma'am.
Renewal?
Good afternoon, everyone. Darren Hood, HOOD, Director of Reentry Services with Renewal Incorporated. Today, our program numbers in work release were 65. Our inpatient were at 30, giving us a total of 95. We have 85 open beds. Employment percentage currently is 60%. It's due to a lot of releases and new intakes. However, our average wage rate is $19.25 per hour. Releases first to end of every month. May, 41 reentrants exited the program, 23 successful. We had 8 escapes, 7 program revocations. Those revocations were anything from behavioral or court-ordered. We had 0 deaths, 0 non-fatal overdoses, 0 uses of force, 0 self-harm incidents, 0 suicide attempts. The number of times emergency medical services were called and reported to either building for county reentrance since the last jail oversight meeting was 3. EMS were called for the following conditions. Once for a swollen foot, a second time for abdominal pains, and a third for numbness in legs. Some special community service projects. On Sunday, May 4th, the annual 2025 Dick's Sporting Goods Pittsburgh Marathon was held, in which we had 12 county reentrants volunteering for community service at that event. And at this time, I would like to take a moment to mention Renewal Inc.'s Get Paid Workforce Development Program that was being featured in Pittsburgh's Downtown Partnerships Perspectives, May 2025 edition. I passed out some blue folders to everybody on the board for your review. There's some brochures and other information in there in regards to our Get Paid program. Get Paid is a subsidiary company of Renewal Incorporated that offers on-the-job training for Renewal's county and state reentrants. Get Paid is a fancy acronym for gaining employment through advocacy, initiative, and dedication. It is a 6-month work program that pays a wage of $15 an hour with a work week consisting of 28 hours for each participant on the team. The program is designed to support individuals reentering the workforce after incarceration. Get Paid partners with Pittsburgh Downtown Partnership, also known as PDP. Those are the guys in the yellow, the Golden Triangle ambassadors. The Renewal Clean team is comprised of a training site supervisor and 4 to 6 Get Paid participants who perform tasks such as pressure washing alleyways, streets, and sidewalks, biohazard pickup, graffiti removal, and painting in downtown Pittsburgh. During colder months, services expand to include snow and ice removal and other additional responsibilities. Renewal is excited to announce that we recently expanded Get Paid with a second team also comprising of a training site supervisor and a team of 4 to 6 Get Paid participants. Currently, we have 1 county reentrant working for the new Get Paid team. However, we've had many in the past and look forward with anticipation to many more in the future. In addition to expanding with a second Get Paid team, Renewal again is proud to announce a new partnership with the Western Pennsylvania Conservancy, in which our Get Paid expansion team will primarily be responsible for the daily watering of 166 planters throughout the city's corridor. This team will also be involved in the various painting projects such as light poles, utility boxes, gray doors, bollards, planters, and graffiti cover-up. The benefits reentrants reap participating in Get Paid are the following: job readiness training and support, job coaching and career development, workplace safety training, customer service skills, time management and organization skills, teamwork and collaboration, understanding workplace hierarchy, and job placement. After completing the Get Paid program, Renewal successfully placed reentrants with the following employers: Pittsburgh Downtown Partnership, Alicio Plumbing, Frontier Construction, and Republic Services Recycling, to mention a few. We are also in the process of reaching out to Pittsburgh Public Works, museums, libraries, commercial, industrial cleaning companies, waste management, Pittsburgh parking garages, and in addition, we attend multiple outreach events consistently throughout the year.
Questions? Ms. Hallam?
Hi.
Hello.
This is cool. I want to know more about this, but just a couple quick questions. First of all, so it's a 6-month training program. So does that mean it's only eligible to certain people who are in Renewal, or like, do most people do at least 6 months there?
No, a lot of guys, they depending on when they get hired on, they can work upon their release, but they can't go past the 6 months.
Okay.
And we've had many people, get released from Renewal and still report to work and finish out their 6-month program.
They can keep, like, nothing changes as far as their job duties or anything. It's just that they're at home now coming to work.
Correct.
Cool. And then I heard you say that they get paid $15 an hour. Do they get to keep all of their $15 an hour? Is there anything that Renewal retains?
As far as I'm concerned, it's $15 an hour.
Okay, awesome. And then last question is, does someone pay, like, does the city or the Pittsburgh Downtown Partnership or someone pay for the services of the cleaning up downtown? Pays Renewal something?
Yes, they pay our people, and they basically set the itinerary for what needs to be done. Because our other team does, a lot of the street cleaning and so on and so forth. The new team's taking on all the planters that they just had planted this week, and that requires daily watering. And then there's a bunch of painting projects, especially with the NFL draft coming next year, I guess, the beautification of the city. So they're going to be busy, and they're going to be working hard. And the guys that we selected that, I should say pursued the Get Paid positions, they enjoy what they do. They show up to work. I mean, we've had very few problems with reentrants, dragging their feet, not showing up, no calls, no shows, stuff like that. So, I mean, there's been a few, but for the most part, we've had great success with it.
But what is the entity specifically that is paying Renewal for this program?
Pittsburgh Downtown Partnership.
It is PDP. Okay, thank you very much.
How you doing? Yeah, I just have the same question about revocations and the appeal process. Is it the similar situation as Pathways?
In the event someone is returned to ACJ, what about the possibility of returning back to the center? That's determined in conjunction with the jail. The jail has policy and procedure for all placements. Renewal receives the referrals and arranges the transfers from the jail. So, that answer?
Yeah.
Good.
And I do have one more follow-up. You said you have 85 open beds.
Correct.
And what is the holdup on filling those beds?
I think maybe it could be a combination of some, the courts needing to talk.
So it's not a hang-up at the
judges.
jail, it's something with the courts that we need to address?
I don't believe so. We've met with Warden Wingardens. Everything, I don't know exactly where,
Say less.
Where
Thank
the
you
hitch
very,
is.
very much.
Electronic monitoring.
Good afternoon, Board. Steve Eswine for the Probation Office. So we have 581 individuals enrolled in the program. During this reporting period, 86 did complete successfully, and we did have 3 that returned for program violations.
Questions?
Any questions?
Thank you.
No. Thanks.
Nobody signed up for public comment on board actions and motions, so do I have a motion to approve the minutes of the May 1, 2025 meeting?
So moved.
Second.
All in favor?
Aye.
Any opposed? Okay, old business updates from committees. Does anybody have an update?
Do you want to do this for come up for me or don't Go ahead.
Hello, everyone. So the Use of Force and Lockdown Committee met on May 28th, and we decided to request a formal meeting with the jail administration, and they already responded to us very quickly. We have a meeting scheduled for the 18th. We're just requesting to view some policies, including the segregated incarcerated individuals policy, the restraint and seclusion policy. We're seeking a little bit more information and transparency around lockdowns, and it's important to emphasize just how impactful lockdowns are to the incarcerated people, so that we don't lose sight of that. I mean, every time we go, we hear the same complaints over and over again, but lockdowns especially is one of the most important things. So look forward to hearing more information about that after the 18th.
On the Employee Welfare Committee, speaking of lockdowns, the Employee Welfare Committee is going to recommend to this board to urge County Council to allow the use of shackles for hospital runs. Just so you know, we all know that there's, I don't know the percentage, but a lot of the lockdowns are due to a staffing shortage. So, yeah.
May I ask a question about that? And how exactly do you think shackles and overturning the will of the voters via referendum would fix your staffing issue?
Well, I'm going to answer that if you let me.
Thank you.
For the first quarter of 2025, it cost the jail $278,240 in overtime for these trips. So if you, and this is obviously an estimate because this is based on the first quarter, but if you use the first quarter numbers going forward for the whole year, these trips will cost in overtime $1,111,960 because you need 2 COs per trip. So if you had 1 CO, you would cut that number in half. You can't have 1 CO unless you have leg shackles because it's unsafe. It's also, I mean, the look on your face is astounding to me. Do you not read about the attempted escapes in
Judge,
the hospital? Are you not concerned about public safety, about the medical personnel in the hospital, about the people that are in the hospital?
Judge, if you would let me answer your question.
Escapes goes on.
I do, and I also know that prior to leg shackles being banned from being used, the same number of officers were out of the jail for hospital runs. That has not changed. So that actually has no correlation whatsoever. The same number of officers that currently are required without leg shackles to go on hospital runs are the same number of officers that were required when they had leg shackles prior to the ban.
You'll have to show me those statistics.
Well, I mean, it's just, it's jail policy. I mean, it's a policy that did not change with the banning of leg shackles.
Right now, when a sheriff takes a prisoner, they have one sheriff because there are leg shackles. Because the COs may not use leg shackles, you have to have 2 COs.
But you had to have 2 COs with leg shackles, is what I'm
Well, the jail is
saying.
going to change that policy.
So the jail has agreed to re-implement leg shackles and 1 officer going on hospital runs?
The jail is not able to agree to that.
If the
County council has to authorize the use of leg shackles, only we're asking, the Employee Welfare Committee is recommending, okay, for medical visits.
And the jail is telling you that if that were to happen, they are only going to have 1 CO on hospital runs? Because that was never the case before, even when shackles existed, so I'm just curious.
That's accurate. I don't believe it was the case. Obviously, we would review it if that would be overturned.
But I do think it's a really important data point here, is because they're saying a new thing would happen that would save money if leg shackles were re-implemented, and that's not the case. When leg shackles existed, there were also multiple officers used then. This is a new ban, and so I was on the board when leg shackles were still used. There were always multiple officers who left the jail.
Warden, I can't answer that question. It's a jail policy.
But since this is the Jail Oversight Board, we should
Yes.
talk about that. Prior to the banning of leg shackles, how many officers went on hospital
You
runs?
just said 2.
2. And so even with shackles, so that argument about how much money it would save, it doesn't actually impact
It
the
did
saving of funds.
under the old policy, but Warden, 1 sheriff takes a prisoner with leg shackles, so would 1 CO take a prisoner with leg shackles?
Correct. 1 sheriff does take someone with, and I'm not sure what all equipment they do. I know they have leg shackles. We would obviously have to evaluate if that's a possibility at the jail.
Right, but
if it's overturned.
But you understand why, if that is going to be an argument, a driving force for trying to overturn the will of the voters, I would very much like to know this is going to actually do that, because I don't think it is.
That's fair.
Yeah.
That's fair.
Okay, I appreciate that, Judge.
Yeah, I agree with that. I mean, it would be a waste of time.
Also, has the committee then,
That's a fair point you're making,
Mm-hmm.
but that point does not address public safety, which I feel that, and the Employee Welfare Committee feels that, the use of shackles on hospital runs for public safety itself would be a reason to reinstate them.
are you saying that you have seen data that's shown that escapes have gone up since when we
Yes.
did have shackles?
Yes.
Okay, I will also dispute that as well. I don't want to list statistics that I don't know off the top of my head, but I know that that's actually not true either. But the thing I wanted to ask, because I do very much care about public safety, and I do very much care about trying to solve the staffing crisis at the jail, because we all agree, we know lockdowns are happening because there's not enough staff. Has the committee looked into at all the proposal to maybe not have the staff at the jail do transports to the hospital?
Well, the sheriff, I mean, yes, the committee has approached the sheriff, who says that no way could that be undertaken at this point with their current staffing level.
Correct, but with more funding allocated to the sheriff's office and taking it from the overtime costs at the jail, the sheriff, and more staff.
And more staff.
Right, but-
So it couldn't happen overnight.
Of course, as nothing does. I wish it did, because we'd
Yes.
have all these problems fixed. But is that something that the committee's going to work towards, the steps towards making that happen?
Yes, we would like to see both happen.
Because,
But-
as someone, yeah.
We don't have any control over the sheriff's funding.
County
or
council
the
does.
Sheriff's staffing.
Correct.
Okay.
So that's why I'm saying if you're looking for a proposal to make to county council, I think a great proposal that a lot of my colleagues would be on board for, because I've spoken to them about it before, is allocating money, and the county executive who writes the budget is sitting right here, but allocating funding to the sheriffs to be able to start that process, because to me, that really is the long-term solution. We
Well,
still had
I
staffing
agree.
crises when we had
If I can
shackles.
say this, when we brought it up to the sheriff, he also indicated that he wanted that to be in an emergency. He wanted that to be the jail's primary responsibility and not the sheriff's office responsibility.
But I think the primary reason was
They have the transports, yeah, staffing money.
And like vans or whatever it is
Yes, and that they have the
use.
transport responsibility from institution to institution, and they didn't want to be doing medical visits. They felt that that was the CO's responsibility, and that other accommodations could be made to make that possible, as opposed to hiring and all that. They're having hiring issues as well. So they felt that it would be easier to do their, anything that they could address through the jail, as opposed to putting that off on the sheriff's office.
Yeah, Judge Bigley, respectfully, the sheriff's office does not have vacancies in staffing. They are last
No,
the
I'm
sheriff
talking
spoke about
I'm
it.
talking about additional staffing for this purpose.
Right, but I thought you talked about they were having problems hiring people, but
No, I'm
the only
saying-
reason they don't hire more people is because they don't have more money.
I know.
Right.
That's what, but I'm saying they don't have the staff to do this, and
Correct, we would have to allocate
what I can tell you is
funding.
we immediately turned to him last time, and he said that's not their responsibility, and they didn't want it. But here's-
May I
here's
interject?
his-
Please.
All right.
Oh, actually, no, sorry, you're not on this
Now, go
board.
ahead.
Yeah,
Well,
but he is a
you know.
designee, and he can speak.
Go ahead.
Okay, so we take over hospital watches that are for extended, long-term sort of situations. Once an incarcerated person has been deemed to be admitted to the hospital as a full admission, that's when we would take over.
Yes. So you are already doing hospital runs once they're staying?
We typically transport two COs and the incarcerated person to the hospital, and if they get admitted full term, we then take over the watch.
Right, so nothing new would be happening, it would just be you would take over the watch if they weren't admitted to?
Say that one more time?
Like under what I'm proposing is, so you're already doing the driving them to the hospital. You're already doing the staying with them if they are admitted. So that you already are doing hospital-related runs. The only thing that the sheriff's office isn't currently doing, which is leading to a massive staffing crisis at the jail, is when they're waiting for an appointment or waiting to see a provider for hours. That's the only time the sheriff's office isn't participating in the hospital run process currently.
Correct.
Thank you.
Yeah. The average length of an out-of-facility medical visit is 10 hours, which is,
Crazy that we would let people leave the jail for that long
no,
when they're jail employees.
well, it's
Not
it's
hospital.
crazy that it takes so long.
Agreed.
But we don't have any control over that either.
I had one, are we anticipating a decrease in hospital runs with the new video visit capabilities?
It was on my agenda, but I'll bring it up now. We did have a really good meeting with AHN leadership 2 weeks ago or so, maybe 3 weeks ago, and that was the topic, and they're working hard, and it's already started to have more telehealth visits. We have real promising, I think it's promising with AHN. We're still going to work with the other hospitals, but with AHN, meeting with their leadership, they've committed to putting a lot of people and resources towards telehealth, which is very positive.
So maybe we'll get some more data on the number of hospital runs.
Well, it would be a reduction. I mean, it would be for medical appointments. Yeah.
Actually, I'm sorry, I do have a question. I just want to make sure I understand what's happening. You're saying the Employee Welfare Committee is making a recommendation to this board or to County Council directly?
No, to this board,
us
and
to
not
recommend.
at the moment. It would be a motion on the agenda at the appropriate time. It's not on there. I'm just,
Okay, I got you. Do we also have,
everybody.
do we have data on how many escapes there has been?
I don't have it in front of me, but I will, the committee will let you all, will give you that.
Okay.
Okay.
Thank you.
All right, any other committee have an update? All right, moving on to new business. Mr. O'Connor, do you have a motion?
I do. I'll ask for a motion to approve brief discussion.
What?
So moved.
Oh, okay. All right. So last month we said that we were going to propose a motion to adopt a comprehensive plan on language access. In the meantime, our staff has worked with the warden's office, the county executive's office, and a subcommittee on this. And what we came up with was a plan that's going to help the ACJ become more compliant with state and federal law when it comes to language access. So it ensures we'll be able to be more accountable, more transparent, and within those improvements, we will have a translation of documents, signs, and services beyond just Spanish, expanding interpreter services, hiring a language coordinator, better screening for language at intake, and also improving staff training. So I really want to thank Deputy Warden Clark for the support throughout this process. And what we've actually been able to do is realize that this plan can be done by the end of the year thanks to the county executive. So I want to thank her office for her leadership, and also just withdraw the motion because we don't need it now that this is already in effect and the work that was done over the last month. So I want to thank everybody for doing that. Thank everybody who's been coming to these meetings for a number of years talking about language access and how it's been able to finally get to the hopefully end of the road by the end of the year this year. So I'll withdraw my motion and just thank everybody for their support.
Thank you. The next item is job solicitor.
Is that one also me?
No, I
Okay.
don't know.
No, it's fine. I can.
I know who it is.
As was mentioned last month by Councilwoman Hallam, that there is one individual who did apply for the JOB solicitor job, and we are going to schedule a interview before next month's meeting. So that's in the process. I do not have a date or time for that, but we will let everybody know when that comes up. But we still have only gotten one applicant.
Okay, and the whole board will be invited to that interview?
Yeah.
Okay.
But we'll work on times and send them out to everybody.
So you'll give us a few proposed?
We'll give you some times when the applicant and coordinate with everybody's.
Okay,
Information
thank
regarding
you.
the applicant.
We'll send out the bio and everything that, yeah.
Anybody else? Okay. Warden's report.
Good evening, Board. Just have a few items I wanted to go over. Since we last met, we've brought 32 new staff into the facility, and that's everywhere from interns up to a doctor, psychiatrist, nurses, LPNs, RNs, warehouse staff, and everybody in between. So that's good. We're having really good luck recruiting for those positions. We also are getting ready to start 22 corrections officers next week, I believe, for the June class, which is a good class. We graduated 16 last week, had a really good ceremony for them. We invited their families in. It was a good ceremony to watch the families and the officers after their training now start working in the facility and get to talk to their families. As I mentioned earlier, we had a really good meeting with AHN leadership. As a result of that, we are going to start going down the road of telehealth. I think is a really positive thing for the facility. The chief and I went out a couple weeks ago and toured Gateway Rehab Facility up in Beaver Falls, I believe it is, to learn more about detox and so how we can apply that to our intake area. The doctor up there, the director, Dr. DeLalo, her and her staff have been great. She's on the healthcare subcommittee. She came into the facility, met with us, and then we went out to her facility, and we're starting to exchange information on how we can do better in the facility with regard to our detox procedures, especially in intake. So we're working with her and her team at Gateway for that. We're really looking forward to that. We also toured Renewal, 2 of their facilities last week. Actually, 2 of their facilities in their training facility last week. Good tour with them. That's our second time around in the last few months. We're going to continue to tour Renewal and talk to the folks down there who work and reside there. Had a good Employees Week a few weeks ago. We appreciate the recognition at County Council. That was really nice. It was the first time, I believe, that the facility was recognized. We had a lot of really good events during that week. Had a really nice ceremony on Wednesday to honor the staff have come before us and the retirees. Have a lot of good events coming up. We're going to do some things down there that maybe they haven't done in the past or in the recent past. Started doing some things like food trucks and those kind of things, and we're going to do a blood drive coming up and different events like that for our staff. So that's all I have for now. I'll turn it over to Deputy Clerk. Thank you.
Good afternoon, Board. First and foremost, I'm excited to announce our new Director of Chaplaincy, Reverend Jacqueline Lyde. Reverend Lyde started at the jail on May 28th, and we're really excited that she answered the calling to serve the residents at the jail. Reentry bags were donated to the jail by students from the Duquesne Law Women's Group. The reentry bags for females include a variety of hygiene products, from shampoo, conditioner, to snacks, hair ties, and all the essentials that a woman would need as she's released from the jail. So we're grateful to them for making that donation to our population. Through a partnership with the First Commonwealth Bank, a new financial literacy class began in the Reentry Center. The class focuses on the importance of credit and budgeting, as well as how to open and maintain a checking account. Participants are also able to open a checking account free of charge with First Commonwealth Bank once they complete that course. The TAILS program is set to begin next Wednesday, June 11th. We'll be getting our first dog at the facility. For those interested in adoption, please keep an eye on the jail's website for details on available dogs. We'll continue to post those as dogs come in. A book vending machine was installed in the visitation area of the jail. Visitors younger than 18 years old will receive a token from the visiting officer, and that token can be exchanged for a free book. This was made possible through the Allegheny County Library Association. The books are funded through a legislative grant, and local senators Jay Costa and Lindsey Williams are the legislators who were involved in obtaining that grant. It's been a great success. The kids are really excited to get those books, and it's a great opportunity for us just to do something nice for the community and make that coming into the jail experience a little bit more positive for those kids that come in to see their family members. In the 2024-25 school year, the Education Center had a total of 14 graduates. On May 29th, the jail held a graduation ceremony for 5 graduates who still reside in the jail. Loved ones were able to attend to support the graduates, and everyone enjoyed a nice meal to celebrate the occasion. That's all that we have, so any questions?
Questions? Manny?
I don't think I've ever gone first before. So I'm sorry. I wasn't prepared. Okay. No. I was actually really happy to hear about the reentry bags from Duquesne. I know you said they're from the Duquesne's Law Women's Group. But can you tell me a little bit more about that? Like, is that like an ongoing partnership, or is that just something that they wanted to do?
And that was just something they wanted to do. They reached out to us to see how they could support some of the women in the jail, and through our collaboration with our Discharge and Release Center and that team, we thought it would be great to give the ladies bags as they leave with some hygiene items and supports that they can use post-release.
I think that's great, and I also can think of some other orgs who may be interested in donating as well. So how can somebody go about?
Just reach out to me, and we'll coordinate through our Discharge and Release team.
All right, sounds good. I appreciate that. Speaking of that, we tape outside of the jail. We actually haven't heard a lot of complaints recently. We used to hear a lot of complaints about not everybody getting their money, just not everybody having the opportunity to even like make a phone call or have transportation. And we haven't had a lot of complaints recently. So, I got to give credit where it's due. We appreciate that Discharge and Release Center. There is one thing that I want to ask about that is not necessarily positive. I got to give props, but I also got to give critiques if it's warranted. Just give me a second. We got an email not too long ago about a food safety assessment report that was done. Hold on, give me a second. I'm going to pull it up. Here it is. All right. There was a food safety assessment report that was done on the 29th. And it's showing a couple violations, some medium and low risk violations. I mean, all the way from, the water supply, hand washing facilities, temperature of food. I'm assuming that's something that y'all are familiar with, right? Now, in the report, there are some, recommendations or corrective actions for every violation, like this one, just randomly. Number 11 is cross-contamination prevention. It's listed as a medium risk violation. Raw chicken was stored above well-sealed, ready-to-eat foods. All right. And the corrective action is to, store raw foods according to the highest required final cooking temperature, highest required temperature at the bottom. My question is whether or not all of the corrective action recommendations have been taken already.
The inspection report was the 29th?
Yes.
So our Trinity program manager, director, he's aware of it. We talked to him on Tuesday at our meeting, and they're taking corrective action.
Okay, I got it.
That's a food, we have a food vendor down there.
Okay, so the vendor takes care of all of it?
The food vendor handles those issues.
Okay.
He staffs the whole entire facility as far as food is concerned.
Okay, I got you. And what is the jail's role? Is it just like an observation role, like a supervisory role?
Obviously, we're going to review those too and support him. If there's cleanliness issues, there's resources, there's things he needs, we'll support him.
Okay, I got you. So like similar to the lockdowns that I mentioned, every time we go, it's very, very similar complaints. Lockdowns, tablets, and food, of course. So I don't want us to lose sight of, how important this is, especially one of the online comments is also mentioning the food. I would like, and I'm not sure how y'all feel about this, I would like us to have some type of update whenever we know that everything that was mentioned on this report is addressed properly.
Absolutely, no issue.
Right. Thank you. I think that's it, but if I think of something, I will ask again.
Thanks.
Okay, so my first question is about telehealth. There's always a concern in carceral settings that with telehealth appointments increasing, fewer people are actually seen by the provider, and they don't have the same freedom to go and be seen by someone else if they don't want to. So can you describe some mechanisms that you're putting in place to make sure that the people, as we increase telehealth visits, we're not decreasing patient care?
Sure. So again, we only talked to AHN so far. They were more than willing to work with us about those kind of questions. We did raise some of those questions. I think it was their VP and a few other doctors that came down. They assured us that won't be a problem, but we're gonna have a further discussion, and it's going to be written. So it'll be. I don't want to say an MOU or an agreement, but it'll be in a written form. We walked away from that meeting feeling pretty positive, but same concerns, same questions. We're going to have those issues. Again, as someone mentioned, these are only appointments. These are never going to be emergency and things like that. But we're going to monitor it, and we're going to listen to complaints or concerns of incarcerated folks if that happens. But I went into the meeting with that discussion point not feeling like it was going to go well with them, but I was pleasantly surprised that they think they have the capabilities. The issues are technology. We got to make sure that our system talks to their system and everything is secure. If there's any holdups at all, that's what it's going to be. And we'll monitor it as we go. And we'll keep you updated on how it's going.
Yeah, my concern is more someone is going to get a telehealth appointment instead of seeing a provider, and an issue is going to be missed, something that's wrong with them that could be harmful. What are the mechanisms in place to prevent that?
Well, that could happen, but I do telehealth. I mean, citizens, everyone can do telehealth, so that's obviously something that people do. And if an incarcerated person feels like something was missed, they can raise that as an issue, and we'll address it.
Right, but right now we know lots of incarcerated people address issues about their health care, and it doesn't always get fixed. So I'm just wondering if additional mechanisms are being put in place to make sure things aren't missed as we're increasing our reliance on technology instead of
Right.
direct.
Yeah, we'll take that into
person care.
consideration. Absolutely.
Okay. Next question is, I'm wondering if who on the jail administration worked with the employee welfare fund on their new proposal that they introduced or talked about today?
What's your question? You want to know who?
I'm asking the warden a question about who in the administrative team worked with the employee welfare fund on this proposal that was referenced today.
Deputy Clerk? Good. Deputy Clerk.
Okay, so is the administration supporting this recommendation?
I'm not sure what recommendation you're talking about.
The recommendation to ask, that's going to come in front of the board to ask county council to reintroduce shackles in violation
Oh,
of
I
the
thought you were talking about the 125. Sorry.
Oh, no, not there yet.
So can you restate your question?
Yeah, who on the jail's administration worked with the employee welfare fund, or is this something that the employee welfare fund committee on this recommendation?
We met with many members of jail
Right.
administration and gathered information from.
I appreciate that, Judge. That's what I'm asking the warden right now. I'm just trying to find out who in the administration was part of those discussions, and if it's something that the administration is putting their stamp of approval on, or if this was something that the committee decided on their
Ask
own.
the committee, who the committee spoke to at the jail. It seems like you're trying to catch the committee in something.
I'm not trying to catch anybody in anything. I just want to know what support this has, is what I'm trying to figure out.
I believe the one or two meetings we had was with our entire administration who was there, and we had plenty of discussions, as the president judge said. And as the warden, I'm willing to listen to any, obviously, subcommittee recommendations. From any of the subcommittees, I'm willing to listen to the recommendations.
But was it something that the jail administration suggested they do, or was it an idea that they brought to you? Excuse me, Judge Bigley, please. I have the floor, and I'm asking the warden appropriate questions.
Unless we're going to get into everything every subcommittee does, I suggest that you have some.
If the subcommittee meetings, especially because they are not happening in public, cannot be discussed in this public forum, then they are a violation of sunshine. So this is the only forum that we have with the public to talk about these decisions that are being made.
Unless something deliberative is being done.
Unless something deliberative is being done, it was a vote or there's a quorum. It's actually not.
Correct.
Something deliberative that is being done, it's not an information session. You guys, as a committee, are deliberating a thing that is being presented to the full board.
When you
So the
guys
full
met on
board
your
is
committee,
the,
were you violating the Sunshine Law?
we talk about it. I'm not saying you're violating the Sunshine Act by
That's
meeting
what
as
you
your
just
committee.
said.
What I'm saying is, since you are meeting outside of the public eye with your committee.
Show, Bethany,
It is-
whatever.
Excuse me, I'm sorry for that, Warden. I'm trying to understand if the administration, if this was a suggestion from the administration to the Employee Welfare Committee, or if this was a thing that was brought by the committee.
I'm going to tell you that the
to-
committee went to the jail administration and raised a whole lot of issues. How can we stop all these lockdowns? How can we reduce your overtime costs? Oh, let's see, one huge problem is the FMLA, which I've spoken about at prior meetings. Another big, huge problem is the fact that 2 COs are leaving on all these hospital runs for extended periods of time, leaving the jail short-staffed.
They always
Okay.
have, Judge. It has always been
I
2
don't need to
officers
argue the
leaving the
merits,
jail.
okay? The bottom line is that we, the committee, went to the jail, okay? The jail didn't recommend anything. It's the committee.
So this recommendation by the committee does not have the explicit support of the jail administration? That's what I'm trying to get to with my questioning here.
Only the warden could answer that.
That's correct.
Okay, thank you very much. I appreciate that honesty there. My next question is about, I don't know if the full board gets these emails or if they just send it to county council. It looks like they send it to the full board and county council. We get these critical incident summaries, right, from the union. And there was some, I'm looking through these numbers and I'm just wondering if we could talk a little bit about how in April, there were 789 drugs that were recovered in the jail. I mean, that's just crazy to me, especially when 636 of those drugs were on one single floor. And my understanding is folks on level 3 do not get contact visits. It's not an intake pod. So I'm just wondering, how do 636 drugs, which is, I don't know why it says it like that, but 636 drugs on one floor in one single month, how are they getting there?
How are the drugs getting into the facility?
How are 636 drugs in 1 month discovered on level 3? Like, where are the drugs coming from? Because they're not getting contact visits. We didn't see numbers decrease during COVID. That's not an intake pod, so we can't say that's not an intake floor, so people aren't bringing it in and coming up to level 3. Like, how is this happening?
Well, I'll speak to the volume. A few months ago, I think we told the board that we formed a security office / intel unit that was never in that facility before, that I know of in the history of the facility. And now we're starting to see the results of that unit doing I think, a more thorough job. I think it's not a secret from the folks that work down there that unit is now fully functioning. We have future plans for that unit. They're using probably avenues that weren't explored before regarding intel, and as a result, I think now we're starting to see the results of that unit that we formed 2 months ago, maybe.
And is it just that floor? Is that the only floor that the unit is on? Is that why that number is so astronomically high on 3? Because, like, for example, the next highest, so it's 636 on level 3. The next highest is level 4 with 97.
Yeah, I'd have to look at that again. They're found in different places in the facility. They're not only found on one level or the other. They're found in different places of the facility. So I'd have to look at that exact report, but not just that level. And the unit is just not on that unit, on that level.
So are we assuming that, like, there's that many drugs on all of the floors and this is just the one where we're finding it?
No, I'm not assuming that.
Okay, so I guess I'm just trying, like, how are the drugs getting there? How is that many drugs getting there?
I'm not going to comment on how the drugs are getting into our facility.
Okay, but there is a plan to look into why that's happening?
Absolutely.
Cool, thank you very much.
You're welcome.
Anybody else?
Yeah, I actually have one more question. So last month, Estock, you talked about quarterly meetings with new recruits. How have they been going?
It's been going well. We're not finding anything that we weren't expecting. Overtime, forced overtime is a big thing for them. Young families are having a rougher time with it, especially if they have young kids at home. But yeah, pretty much that's what's coming up in the thing. They like their job, not getting a lot of negativity from their job itself. It's just the long hours.
I got you.
Can I comment on that? Sure. After he meets with them, or they meet with me before or after, we're both meeting with them, basically. Separate times, but we're both being with them if they have less than a few months there, or less than a year. The only thing that surprised me about that so far is a few of them told me they're signing up for the overtime. I was a little surprised by that, but most of them, exactly what the chief said, it's wearing on them. You know, I would be being dishonest if I didn't say that, or I'd say that it's wearing on them. It's tough to come to a new job, go through the 9 weeks training, and then work the hours that they're working. But I think just sitting down with them and talking to them has, at least their feedback has been good. That we're taking that approach. Obviously we'd like to go further than discussions at some point about why they're working so many hours. But I think it was a good move, and I think it's going to be productive moving forward.
I think it's a good move, too. Around how many hours are they getting, like a week, new recruits?
It could be up to the full week.
80.
Yep. Could be
80.
double their scheduled time.
Yeah, it's 80. Most of them are working 80 for a whole year. It's inhumane.
Yeah, it's
It
definitely.
really is. It's inhumane.
Have you noticed any adjustment with the retention of new recruits?
Well, the class I mentioned earlier that graduated 16 started at 25 9 weeks ago. So I'm not saying all of them left because of that overtime, but the ones that the committee, the subcommittee, and we've reached out to after they leave and say, why'd you leave us? Some of them found other jobs. They were looking for other jobs before when they found this one, but some of them said it was just too much. So recruitment is going much better, I think. I mean, I can't relate to what it was like years ago, but retention is the conversation now.
Okay, thank you.
Okay, now,
I have one more question. It was going off of something that you said.
okay.
Yeah, piggyback.
I know, but normally when you have your allotted time, that's it.
I didn't use all my allotted time.
Okay,
Yeah, I know.
go ahead.
I've been watching that for you. So you know, Judge, you said something about like it's inhumane how many hours, like working 80 hours a week. Don't disagree at all with that. Like I also don't want to work 80 hours a week. But, you know, it seems like there's all these talks about like what can we do to overturn the will of the voters to make the staff happy. But have we ever thought like of reducing the jail population so there's fewer people to have to staff? I mean, we could close down pods. I heard tonight 85 people, 85 beds in Renewal.
You have to go talk to the judges, okay? That is beyond this board's control of when judges commit people to jail or release people from jail or authorize alternative housing.
Judge,
So
I was
barking
not
up a tree.
asking the judges to do anything.
Well,
I'm
that's
talking about the
answer,
jail.
though. What can the jail possibly do?
Well, I mean, what we received a communication this week about something that Westmoreland County was doing, and not holding outside
Well,
detainers for.
Valid point.
Yeah, so I'm just
Valid
wondering,
point.
thank you, Judge. I'm just wondering if that's something that the jail has discussed or if that's something that the jail would consider doing.
So we're discussing every, we're trying to uncover every, we know that if the population comes down, it gives everyone more breathing room. We know that. We're hiring a population manager. They're going to devote a lot of time working with the courts as much as possible. We're working with anybody who will talk to us about how we can reduce it. I'd say it's the low-hanging fruit, but we're making sure that the people who are sentenced to state sentences are going as fast as possible to the DOC. We're trying to increase or decrease that time that they're waiting. The federal, the ones that we can control at the jail, we're trying to talk about almost daily about how we can do that to ease up a little bit. But I think it garners further discussion about where we go from here. As an administration. I mean, we're hiring a population manager whose sole focus is going to be on this, I think is a really good start. And that person hopefully is going to have a background working with probation and courts and all those things, understanding how all that works with hearings and probation and detainers. But I think, as the President Judge said, there has to be further conversation with other entities too.
Well, one thing that this reminds me, because we haven't brought it up in quite some time, but whenever the jail gets a 6A, it can take up to 72 hours to release the person. And the explanation that we received before was, I don't know the word, it just was a little crazy. You should be able to push a computer button and get all the information that you need. It was like run the papers to this department, then they got to go to this department, that's a lot of extra time that people are spending in jail when they don't need to. So would you please have this new person look into that?
Absolutely, Your Honor.
Thank you. Okay, anything else? I would like to add, because I neglected to announce that a fourth member has been appointed, the fourth non-voting member, Mr. O'Connor on the Employee Welfare Committee and Manny on the Incarceree Welfare Committee.
Who else is on that Employee Welfare Committee currently?
Perkins, me, Bigley.
Thank you very much.
Okay, public comment. We have one sign-in. Kiana Proctor, Sorry, it's an internet sign-in.
Is this on general matters or agenda matters?
This is on everything.
We did agenda, I think, at the beginning, didn't we?
Yes.
Yeah. Agenda was at the
I'm sorry?
Is the sheet still in the hall?
Oh, all right, John Kostenowitz.
Is the sheet still in the hallway?
No, it just got brought in.
We brought it in.
Just brought in.
We have it.
Oh, the sheets.
The
I
sheet.
thought
What
she
did you
said
think?
Kiana was in the
Oh, no,
hallway.
sorry, she was asking
Is
if you got the
Kiana
sheet
here?
in from the Wednesday, so, yeah.
This is another narrative from one of our officers. This officer talks about an escape attempt in the hospital in which the officer had to use a hands-on physical intervention of bringing the individual down on the hospital floor in full view of other patients, hospital staff, and the public. I quote, "I was on a hospital run providing escort for an individual needing a medical evaluation at one of our local hospitals. In the crowded emergency room, we were told the wait would be 5 to 6 hours for the inmate to be seen. This gave the inmate optimal time to decide in a crowded area when would be the best time to run. The attempted escape occurred during the time we were in the family waiting area. Because we do not have leg shackles, she was able to get up and run, which is exactly what she did. I provided chase, and at the emergency room exit, I used a physical intervention to bring her to the floor, minimizing injury as much as possible. I continued to provide verbal commands to her to stop resisting. During the takedown, she was laid flat. I secured her upper extremities, and my partner secured the lower part of her body. She was resisting, trying to roll herself up in a fetal position. We got her cuffed, and the hospital security staff assisted in securing her. We positioned her back into a wheelchair, and she continued to resist our direction by standing up. In the takedown and in the process of securing the inmate, I suffered a muscle knot in my left leg, and my finger was injured. I continued to experience pain in my left leg for quite some time, and I still continue to experience pain in my finger. In looking at the video, the public and patients reacted in shock. Many pulled out their phones. This incident did not have to happen. The leg shackles would have secured her into a position where she could not have used her feet to escape. If we had use of the leg shackles, we could cover the shackles with a blanket while she would be in a wheelchair to avoid the social stigma of being leg shackled in public. This incident was very stressful. I was concerned about whether I would have to push a bystander to get to her. In my mind, during the chase and afterwards, I was thinking, what if she took someone as hostage as a way to force her escape? And what if she gets out in the community? During this incident, I was not thinking of needing to... Am I done?
Time.
Oh, gee. Okay.
Okay, Joe Shaughnessy.
Good evening. Joe Shaughnessy, S-H-A-U-G-H-N-E-S-S-Y. I'm here on behalf of PIN to reinforce the basic principle that trans people are people. The LGBTQ population is vulnerable, but trans people are especially and often visibly vulnerable, especially in an environment like the jail. So we just ask for a better treatment, in other words. And lastly, I just want to congratulate Reverend Lyde on her new position in the jail. I'm personally thrilled that she was in that position now because of her deep spirituality, and I wish them well.
Thank you. Sharon Bonavoglia.
We at Penn would like to thank the work of all the JOB subcommittees, and especially the work of the Use of Force Committee. We are pleased to hear that the jail administration is working with the committee, and we hope and strongly encourage the utmost transparency where this critical issue is concerned. Warden Wingard's administration continues to show great promise in jail reform that is leading to better care of our neighbors residing in the Allegheny County Jail. We also encourage Judge Bigley and Judge Abashovic to use their influence in their own courtrooms and with their colleagues to fill the beds at the Renewal Center and to reduce the number of residents at the jail by lifting detainers. And now, if you are able, please rise for the reading of the names of the dead. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Som, Nicole Barufi, Richard Shuba II, Terrence Clowney, Tracy Hickey, and Justin McAuliffe. Thank you. And I would like to shout out to Marion Damick. I don't know why she's been missing the last few months, but we love you and miss you if you're watching from home. We do.
Diana Hull. It's encouraging to see how the members of the JOB are working to improve conditions at the ACJ. I would like to offer a special thank you to Barbara Griffin, who met with Sister Barbara and myself to discuss issues regarding nutrition at the ACJ, and we are looking forward to a continuing conversation regarding this topic. Thank you.
I'm here to speak about the issues around healthcare for transgender individuals in the Allegheny County Jail. How, as we advance in our city, what do we define as excellence? What do we define as public safety? What do we define as community? How are we addressing where people are housed in respect to their gender identities when they step foot on the grounds of this city, these facilities, these systems, with foundations that we did not create, but we do decide if we enforce, if we change within ourselves, in the people we hire, in the people that we serve in these jails, and in this room. Thank you.
Okay, next up is Cake Scott from Community Center. Did I say that name? Oh, the A looked like a C. I'm so sorry, Kaya.
It's okay. Little taller, sorry. Good evening. My name's Kaya Scott. Today I'm here to talk about the struggles of trans people in Allegheny County Jail. Today I want to bring attention to the deeply troubling and often forgotten struggles of transgender individuals who are incarcerated, specifically those being held in Allegheny County Jail. For too long, these individuals have been subject to neglect, violence, and abuse in a system that not only fails to meet their needs, but exacerbates their suffering. This is especially true for transgender people who face a heightened risk of both physical and psychological harm in such facilities. In Allegheny County Jail, trans individuals often face an added layer of cruelty, the denial of gender-affirming care. They are systematically denied access to hormone replacement therapy, surgeries, or even the mental health care that they need to affirm their gender identity and sustain their mental health and well-being. What happens when a person is not allowed to live authentically? The answer is heartbreaking. They become further isolated, depressed, and pushed into a mental health crisis that the system refuses to address. But the situation is far more dire than just the denial of transgender people in the facility. They face sexual assault and harassment. According to reports, Allegheny County jail officers who are supposed to protect the incarcerated have instead been implicated in enabling and even perpetrating acts of violence for trans individuals, especially those placed in facilities based on the sex they were assigned at birth. This leaves them incredibly vulnerable to sexual abuse. But worse still, some of the very officers charged with overseeing the jail have been accused of facilitating this violence, looking the other way, failing to intervene, or in some cases, directly participating. And it is not just about physical violence. The trauma of being misgendered, denied health care, and constantly treated with disdain takes an immense psychological toll. The officers in the jail system routinely fail to acknowledge the inherent vulnerability of transgender people. They are often placed in conditions that perpetuate their abuse with little recourse for safety or justice. They're not given the chance to heal or even feel human in a place where they should be protected. To make matters worse, many people in Allegheny County Jail, including those who are trans, become hooked on drugs during their time there. But this isn't a simple matter of personal choice. In many cases, officers have been accused of enabling this addiction. Officers provide or turn a blind eye to distribution of drugs, pushing vulnerable individuals further down dangerous and destructive paths. For many incarcerated people, these become a coping mechanism, a way to escape the inhumane conditions they're forced to endure. But instead of offering support or resources for recovery, the jail system only enables the spiral, trapping individuals in a cycle of addiction and harm. So what do we have here? We have a system that denies transgender individuals their basic rights, a system that allows sexual assault to happen on its watch, and a system that actively enables drug addiction, turning a place that should be for rehabilitation into a breeding ground for further trauma. The physical and emotional toll on these incarcerated in Allegheny County Jail, particularly trans people, is unfathomable. And the very system designed to serve and protect has instead perpetrated harm and suffering. We can't allow this to continue. It is time for us to demand change. Thank you.
Hi, a couple quick notes. First, congratulations to Bethany for graduating law school, and good luck studying for the bar. And I also wanted to express my excitement about the book vending machine. That's so awesome. And just make a note, for a while we were getting stats on like the ebook checkouts and stuff and how many books there were. Would love to see that back in the report, because that was really interesting. So while I'm really glad to hear my comrades and other public commenters bringing attention to the jail's trans policies this Pride, and I echo the calls for taking a look at them and improving them, I also want to bring attention to another holiday we celebrate in June and its relevance to ACJ. Juneteenth, celebrated annually on June 19th, and an Allegheny County official holiday, recognizes the day in 1865 when the Emancipation Proclamation was enforced by the Union Army in Galveston, Texas, a final stronghold of the Confederacy and slavery. The 13th Amendment was fully ratified by the end of the year, abolishing slavery and involuntary servitude. Something is amiss, though, because Allegheny County as a government institution is still engaging in slavery practices on a daily basis. ACJ utilizes incarcerated workers in the kitchen, but provides no compensation for their labor. Workers have received certain privileges, like access to contact visitation, but that certainly does not equate to a wage. People in opposition to paying workers at ACJ may point to the part of the 13th Amendment that says, except as punishment for a crime. But as we must reiterate over and over again when talking about ACJ, the majority of individuals have not been convicted of a crime and are innocent until proven guilty. Even incarcerated workers at PADOC prisons and prisons across the United States who have been convicted of a crime receive compensation for their labor, even if it is a pittance. This has been an issue discussed by this board for years, years. There's been money allocated in the county budgets, and last year with the new county administration, there seemed to be a political will to finally make paying incarcerated workers a reality. Back in August of last year, the jail reported it was working on developing a tracking system to be able to actually record hours and who was working, and the county administration was working through legal considerations on how to provide compensation without impacting things like benefits, restitution payments, etc. Well, it's been almost a year since August, and we haven't received an update on worker pay in months. The public and the board deserves monthly updates from the county and jail in regards to implementing the worker pay system, and this needs to be a real and actual priority. We've been patient, but no one should have to be patient about slavery, especially in a system funded by our tax dollars. Please give yourselves a deadline and make it happen. Thank you.
Got justice for tall people. Hi, it's been a while since I've been up here. It's always good to talk to the board. My name is Corey Roma, and I'm a resident of Crafton Borough, and I'm here today in the spirit of Pride Month to strongly advocate for the continued fair treatment and protection of incarcerated queer individuals held in the ACJ, in particular those identifying as trans. While the present administration in Washington is dead set on a path of dehumanization and discriminating against trans people and enacting policies in federal prisons that put them at even greater threat, because they were already at high threat, greater threat of physical violence and abuse. We here in Allegheny County have the opportunity to stand above the hate and govern differently. We can commit to a policy of compassion, protection, and validation, including housing incarcerated individuals based off gender identity and enacting enhanced safety measures aimed at protecting LGBTQ+ folks from the heightened risk of harm they disproportionately face while incarcerated. With all the potential for positive change that Warden Wingard's new tenure brings, I hope the protection of queer inmates can be an issue that we make meaningful progress on during the entirety of the year and not just Pride Month. Thank you.
Good evening. My name is Shantae Porter. I'm here to speak on behalf of my trans siblings incarcerated in the Allegheny County Jail to let them know that someone who has actually experienced the treatment that comes to us is speaking for them. Trans people are people. We are human. Therefore, when we go to the county jail, we go to the county jail for the crimes we have committed, not to be judged, not to be punished for who we are, not to be punished for living in our truth, simply just for the crimes that we committed. When you enter the county jail and you go through intake, the embarrassment and the disrespect that you go through by being called him when you're a her or calling her when you're a him is crazy. To sit there and have people pointing at you and laughing at you who are supposed to carry themselves in a respectable manner is crazy, but they want us to respect them when they don't give respect. To be in population, to deny someone their hormone, gender-affirming care, and not do the research and understand that when you take away hormone treatment, you are physically and mentally subjecting people to worse mental health and health issues. To sit there and say that when you are into a physical altercation that someone should come and tell a staff member, but when you tell a staff member what you're going through and that staff member go back to an inmate and say, hey, this person said you did this and this person said you did that, and then they turn a blind eye when people run into your cell and attack you, is crazy. These are things that I was subjected to as a trans woman with breasts, taking gender-affirming care. It was just lucky that I am one of the very few who grew up in the streets knowing how to fight, so I was able to defend myself, who grew up learning from their mother. Talk and speak your mind when someone mistreats you. When you feel disrespected, you correct that person, which people in the Allegheny County Jail quickly learned that I wasn't backing down from the treatment that they gave to me. As a trans woman, as a black, proud trans woman, I'm standing here to say, help my siblings. Look after my siblings. These are human beings. These are not zoo animals the way they are being treated. They're human beings who deserve to be in the county jail, treated with respect and dignity to do their time or until they see a judge and wherever else that path may take them. But we are human beings. Treat us the way you want to be treated, for the simple fact that I can honestly say to you, a lot of people's mental state is that if you treat me like an animal, that's the response that you will get, an animal. Thank you.
Oh, I'm sorry, I didn't hear you.
Hello, I'm Carol Speaks Haddock, Curtis Haddock's mom, and I'm up here to complain some more about my son. And as I'm sitting here listening to you all talk about the medical stuff, I understand you're taking Curtis to a hospital, but Curtis goes to a specialist, and the specialist says you have something floating around in your head, and we don't know what to do about it. This will be, I think, the third or fourth time that I've been down here asking for him, Curtis, my son, Curtis Haddock, to go to UPMC, where the doctors that stuck, maybe you don't understand. All of this was shattered when he was shot in the face. All of this, they stuck it back together. Maybe you think it's going to be too much, it's going to cost too much to take Curtis to UPMC. Curtis has his own insurance. I don't know how many other ways I can ask you to please take Curtis to UPMC, where the doctors have been waiting. I don't understand you. I was told that you would look into it. The petition was taken down in good faith. The phone calls were stopped in good faith. And I'm still at square one. He's not getting the medication that he's supposed to be getting. Then it's given to him without food. It says with food. I mean, you're making him sicker. He keeps writing complaints, and he's being told that his complaints aren't for sick call or sick bay or whatever it's called. I'm just trying to figure out if he was shot in the head and shot in the face and is documented, how could he not be in pain? And if your specialists, neurosurgeons, whatever, if they don't know what they're doing, would you please send my son to UPMC? They are waiting on him. I just took them his medical records. They are waiting on him, which took me over a month to get. Like, I'm just not understanding. And I heard you talk about trying to get people out of your jail faster. Curtis is a federal prisoner. Kicking out so I can fight with them or somebody else because I'm getting nowhere with you. With all due respect, can you please take time to see what it is that you need to do to get my son to UPMC?
Thank you.
Thank you.
Tanisha.
I know.
Tanisha.
Oh, shit, that's me.
You good.
I'll see you there.
Sorry. All right, a couple things. First, I would like to recognize that we do have an illegal designee sitting on the Jail Oversight Board. Absolute violation of the state statute. You all know that. We've had this fight before.
Second, I would like to say, in regards to the leg shackle ban, this is a voter referendum. Voters chose this. You have no right to advocate for overturning the will of the people. More importantly, I'm not worried about incarcerated people running so much as I am worried about the two correctional officers who decide to get physical with each other and solve their relationship issues during a hospital run. I think that's what we should be focused on. More importantly, I would like to talk about two things. One, the healthcare and the policies around housing trans individuals. I believe that you are currently looking over the policies for the jail. And if you read the policy concerning trans individuals and their classification from intake on, it has some very problematic language and some problematic suggestions. In the policy itself, it states that an individual's appearance and behavior can be used to decide where they are placed during intake. I'm curious as to what behaviors indicate whether someone is a male or a female or intersex or non-binary. I think there aren't any, to be clear. I also believe that when it comes to issues like gender identity, the person who knows that best is the trans individual, and no committee can decide that for them. Once they are placed on that pod, per your policy, they lose access to clothing that matches their gender. Things that are available for women or men are then they're denied access to based on the pod they're on. And finally, I do want to speak in support of Ms. Carroll Speaks, in support of everyone incarcerated who is not getting the medical care they need. Lewis Campbell reached out to me today. He has continued to put in sick requests and has not received the care that he needs. In regard to Curtis, we put out a medical advocacy letter, and there are clear disparities between the care that his doctor says he is supposed to get and the care that he's currently receiving. At this point, I'm very concerned that if he goes to the feds before we start getting this solved or resolved, then we're going to have to start this fight all over while he's still decompensating and deteriorating. And that's an issue. It's an issue that people are still on lockdown. It's an issue that when they're on lockdown, they say they don't have the same access to doctors and their sick calls are being ignored. These are all things we have the ability to change, and I do believe we are working towards changing them. I can say with full confidence things are starting to get better, but we're not at a place where we can say they're good. And when we have people like Ms. Carroll who continues to have to come down here and who wants to engage with you on this level instead of having to take her fights to the streets, it makes people lose faith. I think we can do a lot better for Curtis. I think we can do a lot better for people like Lewis, and I think we can do a lot better for our trans brothers and sisters. Thank you.
Tim Stevens. Tim Stevens. I think maybe any alarms going on. That's what I
Good afternoon. Good afternoon, everybody. Try to run through a few things very quickly. Reinforcing Ms. Long's comments during Pride Month, I don't know if you have a commission or committee put into place to look at all the issues with regard to the LGBTQAI community. Do you have something in place? Or you do, or you have? You say yes? Okay. My request on behalf of the Black Political Empowerment Project, Tim Stevens, Chairman and CEO, that that be given maybe a higher priority in terms of examining what is happening, what can be happening. And obviously, if someone says who they are, I think they should be respected for who they say they are in terms of where they are assigned. I think that would be respectful of people. So I'm hoping that that commission or committee will be very active. The issue of incarcerated people receiving compensation, I think that's something that should be looked at very seriously. Particularly as a civil rights activist of 55 plus years, we want no form of slavery whatsoever. I know some of the people are appreciative of being in a situation where maybe they feel a little more comfortable than being in other situations, but finance would be helpful, certainly, and appreciative. The issue of 5 hours to be seen Is there any consideration with area hospitals that people who are brought in from this institution be given a priority, so maybe they won't have a 5-hour window to run? It may be just a practical thing, because that is a concern that John brought up that does make sense in terms of the issue of time. Carol speaks. If I was a parent, I'd be down here too. So hopefully Warden and the board members can confirm that this situation be looked into. She's been here a few months already, and he's been shot in the head or in the face. I think that is certainly more than shot in the leg. So I think that should be given that level of respect and investigation. I'm hopeful that any individual that is employed here that has a series of complaints, that they be looked at, their record be looked at very seriously as to why those complaints continued around the same individual, and that assessment be very deep and steep. And also, when there is anyone accused of physical harm, that case needs to be investigated immediately and very seriously, and there should be discipline.
Yeah, I just wanted to shout out Tim Stevens and BPEP and also the League of Women's Voters for their work to make sure incarcerated individuals had the opportunity to vote. Connie mentioned it earlier. A total of 40 incarcerated residents voted in a primary election. So thank you, BPEP and League of Women's Voters. Thank you.
Okay, either Miss or Mr. Rose, I can't read your first name.
That's Shakina.
Okay, sorry about that.
Good evening, Board. Shakina Rose. I'm from Manchester, and I'm here to support our LGBTQ people incarcerated at the Allegheny County Jail. I'm really disturbed by why I'm here tonight. You know, during Pride, I learned about what's occurring. So I'm going to take a little bit different route than these folks. You know, I've been living here in Allegheny County for about 5 years now, and one of the things that I've been most impressed with, having already been living in woke country, is that Pennsylvania now has become an equality state, focused on equality for all people. And within that, I look at the demographics of the people that are being incarcerated and the people most impacted in our community. And so, as being a part of the governor's office on the Aging Working Group, I recognize the full spectrum of trans lives across the spectrum in Pennsylvania. The governor supports LGBTQ community. He represents everyone in this state. We could really call this out and say this is state violence. To force someone to detransition for a crime they committed, not be recognized for their identity, for who they are, but you can out in the community. We love you out there, but we're going to traumatize you here. And we're going to make you remember the experience. I don't know if any of you have been raped before. I have been raped twice. People often talk about how trans women in female settings is an issue. Why are we choosing to put people like me at risk? I'm sure you all have nieces and nephews. Do you want them to face the same? I should be entitled to the clothing of my gender. You know, you have to ask. People are terrified. How are you going to know when the supplanter has all our data, and it's going to know before we even hit the jail who we are. We're not going to have any say in any of this. That's why I'm here tonight, to speak on the importance of the recognition of trans lives. Thank you.
Thank you. Thank you. Okay, do I have a motion?
Motion to adjourn.
Your Honors,
Yeah.
may I quickly clarify something, if
Sure.
you don't mind? So, Pennsylvania law, Title 16, 1203 states, "The Chief Deputy Sheriff shall have the full power and authority to perform any duty incumbent upon the sheriff, with the same legal effect, whether the sheriff is temporarily unavailable or incapacitated." I'm very pleased to report that the sheriff is only temporarily unavailable today. And in keeping with the law on the sheriff's statutory duty, I sat here to fulfill his role. Sheriff Kraus emphasized the importance of this meeting and asked me to attend to keep our office engaged and informed. Maintaining representation during brief absences keeps our focus on those we serve. We don't serve chairs, we serve people. And that service shouldn't cease when one chair is empty if we can help it. But that's Title 16, 1203 as the Chief Deputy Sheriff.
Yeah, you
Thank
should read the statute that governs our board, though.
We already motioned to adjourn. Motion to adjourn.